All right. Hello, everybody. Thank you for joining us today. Today, we're going to be hosting our last session for our learning collaborative on the road to health, how to prevent or delay type 2 diabetes in your community by the National Center for Health and Public Housing. So before we get started, these are just a few housekeeping items to keep in mind. All participants are muted upon entry. If you're not muted, please just make sure that you mute yourself so that we don't get any interruptions during the presentation. Also, make sure that you engage in the chat if you have any questions or any comments. Make sure you raise your hand if you would like to unmute as well. This meeting is being recorded. The slides are recorded. It will be sent via email as well. And please make sure that you provide a brief introduction of yourself with your name, organization name, and your title. And you can do that in the chat. And today we're going to be doing some activities with the use of Mentimeter. So if you can go to menti.com, enter the code that we have on the screen, 5404129, or you can also scan the QR code that we have on the screen and also enter the code. And once you enter and go to that website, you're going to see some questions that we're going to be going over later on in the presentation. And Chantal, do you mind putting in the code information in the chat as well, please? Thank you. All right, and then for today's speakers, again, if this is your first time joining us, my name is Frida Pineda Sandoval, and I am the Training and Technical Assistance Manager here at NCHPH. We also have Dr. Jose Leon, who is our Chief Medical Officer at NCHPH. And then today we also have Chantel Moore, who is our Communications Manager, and she's going to be helping us with the breakout rooms and a lot of the other engagement activities that we have today. All right, Dr. Leon, I'm going to pass it on to you.
Thank you, Fide. Hello, everyone. Good afternoon or good morning to you, depending on where you are. It's been a great pleasure to be with all of you for the last few weeks. Just going over a couple of things that we have learned together, specifically this training on diabetes prevention and what we can do in our communities to prevent diabetes. Again, our disclaimer, we are funded by HRSA to provide training and technical assistance to community health centers. And the NCHPH organization is receiving over $2 million from HRSA to provide training over the 3-year cycle. Next slide, please. Quick reminder, in case this is the first time you are joining us, we've been discussing and talking about health centers close to public housing developments. As you know, our organization provides training to health centers located in or immediately accessible to public housing. However, the activities, the training are free for all health centers. In 2021, the most recent year that we have, 458 health centers provided services to those living in or immediately accessible to public housing, and they serve 5.7 million patients. 108 of the 458 health centers are public housing primary care grantees, which means that they receive special funds from HRSA to provide the services to this special population. And in the same year, they provided services to over 900,000 patients. Next slide, please. As we've been discussing, this is a slide showing the public housing demographics. We know that about 38% of those living in public housing have one type of disability. 43% are African American, 26% are Latinx, and 19% are over the age of 65. Overall, there are 1.5 million residents living in public housing. However, since the health centers serve not only those living in public housing, but those in or immediately accessible to public housing. They have been providing services to over or around 8 million patients in 2021. Next slide, please. So we are going to review today. We are going to review what we have learned so far. We have some case studies that we would like to discuss, and we are going to learn some methods on how we are going to talk to our patients. We've been talking about motivating our patients to exercise, to eat healthy. However, it's not an easy task. There are several things that we need to consider when we are going to talk to our patients, and one of them is a stigma. So we will be discussing a couple of methods to deal with how we can talk to our patients, but as an icebreaker, and you can use either the chat box or you can just unmute and participate verbally. And according to your experience, what settings can people face weight stigma? And the next question is, what type of stereotypes are reported by people with overweight or obesity? Anyone? Physicians' offices, correct. Cruelty, correct. Lazy, yes. Healthcare clinics, yes. Those are all right responses. There are several studies, and every time that we do this type of trainings, we try to make sure that we provide information that is supported by some research. So what we are saying is something that you can you can compare, or you can talk, or you can discuss with your health centers. There are several places, you know. I mean, when we talk about weight stigma, there are several settings. One is in education, for instance. Children, obese children are those suffering bullying because of their weight, and yeah, they are victimized by their peers. They suffer a lot of bad words or names just by the fact that they are obese. The other one is in the workplace. You know, even when you are going to a job interview, how you look, how whether or not you are obese or not, can somehow influence a decision to obtain a new job. In personal relationships, that's another environment where we can have or we can face some stigma. Healthcare settings is quite interesting to see that some patients and even are stigmatized by physicians or nutritionists or dietitians or fitness professionals. So we need to keep that in mind, because we've been talking about how to make sure that our patients are on a diet, or how our patients can eat healthy. However, we need to be very careful when we talk to them, because all these issues can cause some kind of a mental health issue or behavioral health issue with in our population. So let's make sure that we have the right way to talk to our patients, and make sure that we analyze what and we provide positive feedback to our patients before even starting a conversation about diabetes management or diabetes prevention. Next slide, please. And just to go back, Melanie, the obese person can be accused of not caring about their health. That is totally correct. And embarrassing, and that is something that is also correct. So as we have seen so far, there are patients can face a stigma, and even patients with diabetes can be stigmatized because of their weight. So let's get a quick review of what we have learned in the last three weeks. We have learned how to diagnose prediabetes based on blood work results, either through the A1C or FPG or the OGTT. Make sure that we keep this slide in our mind, and if you can, we can come back and see this slide again, because part of the exercise that we are going to do today is to make sure that we can see whether or not our patients are suffering prediabetes. Next slide, please. So we went over as well on ways that we can prevent or delay diabetes. One is by exercising. We need to motivate our patients. We need to find the challenge that they have and then see how they can overcome that challenge. We need to make sure that our patients are eating healthy. One of the difficulties is sometimes our culture. We need to be aware and familiar with the culture and the background of our patients, because let's say that you have a patient from Latin America, and tortilla is one of the main products that they're going to eat. You know, when you analyze tortilla, they have a lot of carbohydrates, and you can reduce the number of tortillas. You know, probably they won't be able to eliminate tortilla from their diet, but they can look for healthy or healthier options. So those are the things that we also need to keep in mind. Next slide, please. We also went over complications. We discussed some of the chronic complications, specifically stroke or blindness, some heart disease issues, kidney disease issues, and amputations due to a neuropathy or vasculopathy. But these are one of the things that we need to talk to our patients and making sure that they understand that this is a chronic condition and that this chronic condition can cause different complications. Specifically, it can damage our organs or main organs, and making sure that they do understand the risks and how they can prevent the risks. Next slide, please. Next slide. And so we also learn about portion and serving and the difference. And that we went over some exercises regarding portion or serving. It's something that is confusing for some of our patients, so we can explain to them the difference and how they make sure that they read food labels and how they understand that this is going to be extremely important to prevent diabetes in our communities. Next slide, please. We also went over the nutrition label guide. We learn how to read it, where we can start. We need to learn what the serving size is, and check the number of calories, the type of nutrients or the vitamins. And we also learn something important. Something that is 5 or less is considered low, and something over 20% or 20% or more is considered high. In other words, if we have sugar, right? Let's take a look at the one. The sugars in on this particular label are 5 grams. 5 grams is considered, according to FDA, and is considered low. So patients can have this type of food. However, if you have a piece of cake, you know, that you buy and you are able to obtain the nutrition label, and the nutrition label says that for each piece that you get, you are going to get 30% of sugars. That's something that they need to avoid, because we also learn a little bit about the traffic light method. So next slide, please. So this is something that patients can understand, whether this is something that they need to avoid, or if there is a some kind of food that they have to be very careful and just have once in a while, or some kind of meals that they can have every day. So if we are able to make our patient understand the difference between the different type of meals that they can have, or nutrients, and use the traffic light method, they are going to be doing great improvements, and specifically to prevent not only diabetes but obesity or being overweight. Next slide, please. Then we went over exercise programs. We learned what the main issues are for patients and challenges. And patients mentioning lack of skills, lack of resources, weather conditions, travel, family obligations, and lack of willpowers. And it's easier to be in front of the TV, having some popcorn or chips, you know, and just, if you have to make a decision, it is easier than just walk around and do some kind of exercise. Let's make sure that we address these challenges, we address this what our patients are mentioning, and let's try to find a way that they can exercise. And according to what we learned, we need to try to make sure that our patients exercise for at least 150 minutes, which is almost 30 minutes, 5 days a week. And at the same time, asks the patient and motivate the patients to do other exercises like yoga and strengthening, and exercises in addition, other exercises in addition to aerobics or exercises that will help them to burn some calories. Next slide. We also learn in the last 3 weeks how we can make physical activity part of our patients' lives. And we have all these activities, we have done all these things that we have done, and we went over these guidelines or these tips to make sure that we help our patients to be more active. Next slide, please. And finally, we discussed the body weight planner. This is an NIH resource that you can go to the website that is on this slide, and make sure that we have, you know, through this, some steps, we can see, we can establish an exercise program and the number of calories that a patient needs to burn in order to get to their his or her ideal weight. And so this is a really nice app and a really nice resource for our patients. Next slide, please. Then we learned about this from one of our participants as well. This is the screenshot of a UCAP that she mentioned. And it is extremely useful, and something that we can discuss with our patients if they have access to a smartphone and download this type of application. Next slide, please. All right, so this is what we learned, and now we are going to test what we learned. So we have a series of questions here that we would like your participation. Remember that this is an activity that is interactive. So the idea is to see where we are, whether or not we have gotten the basics, and let's try to make sure that that we choose the right answer. for this particular activity, we are going to use Mentimeter. You can use the QR code that is on the screen, or you can go to www.menti.com and enter the code 5404129. And Chantal, would you like to take it from here, or do you want me to read the questions?
Sure, I can read the questions, Dr. Leon. Thank you. All right, everyone. So I'm going to give everyone a little while to log in. It's like we have 9 people so far.
Mhm.
If by any reason you don't have access to Mentimeter, we know that many, if not all of you, are working, and then you are in your office or in your clinic. You can also participate via chat, and just type the right answer or the letter that is the right letter for the response.
All right, we are ready to begin. Start out with our first question. All right, so a blood sugar less than 70 is called the correct answer is hypoglycemia.
Excellent. So we got 10 out of 10. Perfect, everyone. 11 out of 11.
A blood test that measures 3 months of blood glucose levels is known as the correct answer is A1C.
Thank you, everyone, for participating. A1C is the test that we can use to measure the blood glucose level in a patient for the last 3 months, for the last 90 days. And it's the standard, I would say, test that we use to diagnose either diabetes or see whether or not the diabetes of or the glucose of our patients is controlled or uncontrolled. Next slide, please. I'm sorry, next question, Chantal.
True or false? Fruits and starchy veggies should be avoided. The correct answer is false.
Excellent. Thank you, everyone. We got 11 right answers. And again, remember that starch and fruit and some fruits, not all of them, have a lot of sugar. So for our patients, we need to recommend that they do not stop, I would say, eating all these things, because even though they have sugar, those are sugar that can be easily be eliminated. These are what we call complex carbohydrates, and complex carbohydrates are not shouldn't be avoided because they are easily eliminated by our body. Next slide, please.
True or false? The physical goal for all individuals is to do about 30 minutes of activity on most days. The correct answer is true.
Thank you, everyone. And that is correct. The recommendation from our federal organization is that all individuals, regardless of our age or our physical status, if there are no contraindications for us to exercise, we should exercise for at least 30 minutes, 5 days a week.
This is the goal for A1C. And the correct answer is less than 7%.
Thank you, Chantal. Remember that the goal for all patients is to try to keep their A1C lower than 7% or less than 7%. And everything that is above 7% is considered not good for our patients. And so let's make sure that when we talk to our patients, we need to ask for their A1C and just remind our patients that their A1C must be less than 7%.
Unused calories are stored as the correct answer is fat.
Thank you for participating, and that is the correct answer. Remember that our body tries to get, as much energy as our body can. So every time that we consume more than what we need, our body will use or will convert whatever we eat into fat. And the reason is that our body, when there are other days when we are not consuming enough, it will use that fat to use it as either sugar or other nutrients that we need. There are some processes in the liver that we have not discussed, but those fat, the fat and the that is in our body will be used to produce sugar if we are not having enough sugar. Next slide, please. Thank you so much for participating. And I am very happy to see that we got a pass score for everybody. So thank you. That's the purpose of this activity. We went over the. We did a brief overview to make sure that we had understood what we discussed, and this is just a test for us to make sure that we understand and that we see progress. So we are very happy to see that everybody got a pass score. Thank you so much. Next slide, please.
Give me one moment.
So in the very beginning, we talk about obesity and some challenges that people who are obese or overweight can face, specifically regarding a stigma. And when we are having a conversation with our patients, sometimes it's not easy to start a conversation with a patient who is overweight or obese, because these patients have experienced some kind of a stigma in the past, either as children or in the workplace or if where they work. And people use, some nicknames and words just to stigmatize this person. So every time that we have a conversation with our patients, we need to make sure that we offer positive feedback, that we are not judgmental, that's not our role. Our role is to help our patients. And there are two ways and two methods to discuss this issue with our patients. The very first one is very well known for many. This is the 5 A's. This is a method that is not used not only to support patients who are obese, but patients who are trying to stop smoking and this is something that can be used. The 5 A's stand for ask, assess, advise, agree, and assist. If we are asking our patients, we can ask them whether or not they would like to lose some weight, or whether or not they believe, that they need to do some exercising. So we assess, we make sure that we understand whether or not our patient is willing and able to make some changes. Then after we have asked and assessed, we need to advise our patient. We need to provide them with some of the techniques or tips that we learned regarding exercise, how to exercise, how to eat healthy, the type of food choices that they need we've been talking about culture, making sure that we also assess and advise on the type of food that they have every day. Then there has to be some type of agreement, and the patient, you and your patient can discuss, okay, in 6 months, you would like to lose this amount of weight, or you would like to exercise at least 4 days a week, 5 days a week. And this agreement is going to be between the person who is interviewing the patient and the patient, and then provide some assistance, right? I mean, some health centers are helping patients to fight the social determinants of health. For instance, we in the conversation that we had in the past, or in the last week or the previous week, we discussed that community violence is an issue in some settings, and health centers are assisting patients by providing indoor activities, or other health centers have food pantries, and just making sure that patients understand how to cook and how to eat healthy. So these 5 A's method is extremely useful. And again, the idea is not to stigmatize our patients or making, we don't have to, our patient doesn't need to feel uncomfortable when they have these conversations. And this is a really good method to help our patients. Next slide, please. The other strategy is motivational interviewing. Motivational interviewing is trying to find something that the patient needs, or in order to make the change. There has to be a motivation. There has to be something that the patient is willing to do or sacrifice in order to achieve their goals. So this method is about asking open-ended questions. We cannot ask questions a patient like, do you want to lose weight? That is a close-ended question. What we need to make sure is that the patient can provide additional information. And just by asking open-ended questions, we can get that information from our patients. The other one, the other part of this strategy is to provide affirmative statements. So let's make sure that, again, what we are doing is helping our patient and is not hurting our patients. When we discuss obesity, when we discuss overweight, when we discuss diabetes, or when we discuss their diet. Yeah, we can't say, oh, what you are eating is too high in carbohydrates. Instead of doing something like that, let's tell the patient what a carbohydrate is and how the carbohydrate is affecting their weight or their glucose, if we're talking about diabetes prevention. And then provide some reflections on some summary statements. Specifically, okay, I've heard that you would like to do this, and this is how you can do it. If this is something that is not, if we are not providers, if we don't have the direct contact with the patient, we need to make sure that we also refer our patients to the clinic, back to the clinic, making sure that they receive the assessment from one of our clinicians or our nurses, or dietitians, and then help them in the community to get all the resources that they need. Next slide, please. Then the motivational interview has other steps, specifically in regards to some discussion points regarding type 2 diabetes, explain the patients what type 2 diabetes is and how losing weight is going to help the patient, and how patients can make sure that by managing their diabetes, they are going to feel better, and they are going to avoid not only get diabetes complications, but they are going to be avoiding, or eliminating other risks or risks for other chronic medical conditions. Next slide, please. Then we need to provide, again, make a statement, make an agreement with our patients, similar to what we've done with the 5 A's method, and having an open and very friendly conversation with our patients. We are here to help. We are not here to judge our patients. We are not here to scare our patients about complications, about what is going to happen if you don't change. It's just, instead of doing it that way, let's talk about the positive things that they are going to achieve if they change their lifestyle. Next slide, please. So I'm going to stop for a moment. Since we are assessing and we are talking about what we can do with our patients, we have some case studies that we would like to discuss with you. Fide and Chantel are going to lead this part. So Fide, take it away.
Yes, thank you, Dr. Leon. So for the first case study, I'm going to read it, and then we're just going to have some questions for you to answer at the end, okay? So a 46-year-old female is referred to your health center for an abnormal fasting glucose of 115 milligrams. She has no significant past medical history. She takes several vitamins, but no prescribed medications. Her family history is remarkable for type 2 diabetes in her and her father. Her physical examination is notable for a height of 152.5 centimeters, weight of 64.9 kilograms, body mass index of 27.9 kilograms, and blood pressure of 121/80. A 75-gram oral glucose tolerance test is performed to evaluate her for undiagnosed diabetes, revealing a fasting plasma glucose of 117 milligrams and sorry about that, Dr. Leon, and two glucose of
a 2-hour glucose.
And a 2-hour glucose of 153 milligrams. A hemoglobin A1C is 6.4%. So the question is, does this patient have prediabetes? Based on what the case study says, what is the natural course of untreated prediabetes, and what lifestyle changes would you recommend to this patient?
Anyone who would like to participate verbally, again, we have the chat if you prefer, but let's take a look at the numbers. The 75-gram oral glucose tolerance test showed that after 2 hours, the patient had over a glucose of 153 milligrams per deciliter. the hemoglobin A1C came back at 6.4. So based on these numbers, does our patient have prediabetes?
Okay, so far we have 3 participants that have said yes.
And that is the correct answer.
Mhm.
So if nothing is changed, let's say that the patient doesn't receive anything, the patient doesn't receive recommendations. What is the national curse of untreated prediabetes? What is going to happen to our patients if we see this patient in 2 years, 3 years, 4 years, 5 years?
Mhm. Yeah, so we have a response, Dr. Leon, by Nancy Martinez. She's saying without lifestyle change, she will develop diabetes.
Correct. And that's the right answer. Our patient is going to be diabetic. And if untreated, or if our patient doesn't make any changes, what is going to happen is that the patient is going to start having some of the complications, diabetic complications that we have already discussed. That is correct, Melanie. The patient is going to have neuropathy and diabetic complications, heart disease issues. That is totally correct.
Mhm. Also
Right.
leading to stroke and heart disease.
Correct.
Mhm.
So we don't want to go that way, right? So when we see this patient and when we talk about his blood work, what lifestyle changes would you recommend to this patient?
Okay, we have a response for that one saying, let me see, exercise and healthier eating habits,
Correct.
eat fewer calories, eating healthier.
Correct. Exercise. That is correct, Joanne. And I was looking for that answer as well. Remember that this is the other pillar that the diabetes prevention program is based on. Exercise 150 minutes every week, or 5 times a week if possible. And diet, weight loss, and exercise. That is correct. Those are the right answers. Thank you so much. Next case study, Chantel.
Thank you, Dr. Leon. Case study number 2 presents a 45-year-old African-American man with a history of obesity and hypercholesteremia has been under your care for the past 3 years. He has a family history of both type 2 diabetes and cardiovascular disease, but no history of cardiovascular events. About a year ago, the patient requested blood glucose screening because his brother had just been diagnosed with type 2 diabetes. At that time, his HbA1c level was 5.8%. The patient reports intermittent success with weight loss, but has been unable to sustain it. He reports attempting to walk most days, but notes that work and family obligations, as well as inclement weather, often make this impossible. How would you address the barriers mentioned by your patient?
So for this case study, we have a patient who is trying to exercise, who is trying to walk most days, but the challenges for this patient are the work-related activities and family obligations. And probably he lives up there in Boston because you guys had a lot of snow yesterday. So what would you recommend to your patient? Those are the barriers. You have already talked to the patient. So what would you recommend in regards to the family obligations, the work, and the weather?
Okay, so we have one response saying organizing the day to allow some time for himself, waking up earlier, using some lunchtime or in between obligations. You can try YouTube videos at home or workout apps.
Excellent.
Mhm.
Those are excellent tips, Nancy. I totally agree with all of them.
Yeah. Also including family members in physical fitness efforts.
That is correct, Sarah. we discussed that sometimes, you know, if they have children, they can go for a ride, and you know, they can ride their bikes for a moment with the children, and have some fun with the family. It's true, we have family obligations, but at the same time, we can take some time, you know, and just have fun with our family, our family outdoors. Basketball, that is correct. And the driveway is our favorite. That's great. That's a great one. I like that one. Prepare a schedule for him and his family. That is correct, David. Melanie, alternative places to walk. Church, with gym, walking around a grocery store, can do some exercise at work. If desk job, take steps, include family play with the pet. Correct. All of them are correct. You know, I mean, there's always an opportunity to exercise. And the best example is use the stairs at work, just put in music. And yeah, I also like that one. Dance will help. So we need to keep our bodies moving, you know, I mean, either indoors, outdoors, and that with a healthy diet are going to be the deterrents for diabetes.
Mhm.
Excellent. So let's move to our third case study.
All right, so in our third case study, JM, a 48-year-old Hispanic man was seen in your health center for routine follow-up of hypertension, for which he had been treated for the past 8 years. His only medication was lisinopril of 20 milligrams per day, home blood pressure monitoring average 128/82, and he had a family history for hypertension, type 2 diabetes, and coronary artery disease. JM reported a 20-pound weight gain over the past year, along with a sedentary lifestyle with no regular exercise routine. Other medical history was negative, including symptoms of fatigue, polyuria, or polydipsia. He denied past or current tobacco use. Patient refers that he does not understand what a healthy diet is, and he is not familiar how to read food labels. How would you provide food labels education to this patient? And what federal resources would you use to address a healthy diet plan? Would you use resources in Spanish or English? And how motivational interviewing could help this patient? All right, we can provide your response.
So I'm quite sure that you have this type of patients. It's my understanding that health centers based on UDS data have served over 25% of patients who prefer to be served in other language than English. And this can be not just a Hispanic patient, but someone from another country. One of the main concerns or issues when we have patients like this is to make sure, and we need to assess the health literacy of our patients, making sure that they do understand what they are reading. Sometimes health literacy may not be an issue, but just the English can be a barrier. English language can be a barrier. So making sure that if we cannot provide the services to the patient in English, then I'm sorry, in Spanish, we talk to this person slowly, making sure that he or she understands what we're talking, and making sure that they receive the resources, either resources that you have created or federal resources that you have found and you think are good resources for your patients. And start any of the methods that we discuss, either the 5 A's or the motivational interview. And so, do we have any responses for this one?
Yes, we do. Thank you, Chantal. She's saying motivational interviewing can help the patient by getting to the root of the issue to help them make lifestyle changes. Also, by Nancy Martinez, teaching the patient how to read food labels, focusing on serving size, calories, carbohydrates, and in this case, sodium because of this hypertension, giving them educational information. We also received a resource by Sarah Coates from the FDA on nutrition facts. So I'm assuming that would be something that would be shared with the patient. Also referring patient to a nutritionist to assist them with how to read food labels. And also we have another response on visual aid for nutrition labels with explanations from NIH, ADA, CDC, Spanish if unable to read in English, and motivational interviewing as well can identify barriers.
Excellent. All those responses are great, and I totally agree with all of you. That's exactly what we need to do with this patient. And just keep in mind that it can be someone from Mexico, from Central America, but we also have and take care of people from Asia, people from Africa, people from other places. You know, there is a health center in San Diego that we have a conversation with, and they serve over 30 people from different, if I'm not mistaken, 28 or 30 countries. So they try to have their CHWs, making sure that the CHWs help with the language barriers, and making sure that you have the resources for your patients. So all this is great. Thank you so much for participating. And we have one more case study.
All right, case study number 4. A 31-year-old white male with no significant past medical history is referred to by his workplace to your health center for an elevated blood pressure. He presents to the clinic with no complaints. His mother and grandmother both have diabetes, and his father has hypertension. He has had a 15-pound weight gain over the last year and has become more sedentary. His fasting glucose is 114 milligrams. How would you discuss a healthy food diet with your patient? Also, what resources would you use to provide diabetes education?
Thank you, Chantel. This particular case study has something interesting, right? When we see the fasting glucose is 114, so that is a red flag for us. Even though the patient has not developed diabetes, he has history of diabetes. So this patient has gained weight. So let's start with how would you discuss a healthy food diet with your patient? It seems that a healthy food diet is an issue for this patient. So not to be intrusive, I guess, or how would you start a conversation about healthy food with a patient who is at risk of developing diabetes based on his fasting glucose, and how would you do that with your patients? DASH diet? Give him CDC information? Assess knowledge base regarding nutrition, diabetes, and HDN based on results. Will outline the conversation. That is a great advice. That's great advice, Melanie. And ask our patient if he had any significant changes in the last year that caused the sudden weight gain. Correct. We need to make sure that we understand what is happening. You know, I mean, a chronic condition sometimes is linked to a mental health issue, a mental health disorder. Anxiety, depression can also be issues affecting the patient. So the more information we get from our patient, the more able we, or the more prepared we'll be to help this patient. Remember that we have to address not only diabetes. I mean, even if that is the main concern, we need to make sure that we address other issues affecting the patient. And so whatever you can gather from this patient is going to help this patient, you know, to get back to a healthy diet and exercise. And we have already discussed resources on how that you can use to provide diabetes education. It was mentioned CDC. It was mentioned NIH. In case you are not familiar, NIH has some really good resources as well. If you go to the diabetes page at NIH, you will find resources for patients in English and Spanish and other languages. So, and you can tailor this and these resources as well, you know, based on the need of your patient. So all these are really good strategies that we can use. So thank you so much. We were supposed to have some breakout rooms. I believe that the time will not allow to go into breakout rooms, but we're going to stop for a moment and see whether you have any questions, whether you would like to share with us anything that you are doing to help your patients, anything that you would like to share, or any question that you can have. Please make sure that this is the right time to do it. In the meantime, don't forget the post evaluation or the post survey evaluation that we have, and your feedback is always important. So in the meantime, are there any questions or any comments or anything that you would like to share? That is correct, Melanie, and you are totally right. The American Diabetes Association has info in different languages as well. That is totally correct. And by the way, in case you are not familiar with this, ADA or the American Diabetes Association, if you are a CHW participating in this activity, they have training for CHWs. If I'm not mistaken, there are 3 self-paced trainings on diabetes prevention, and they are free. The only thing that you have to do is to register. So ADA has these resources for CHWs.
We have a question, Dr. Leon.
Okay.
Saying, is it possible to lose calories in the sauna?
You know, honestly, the short answer is no.
Mm-hmm.
The only reason is that you are getting dehydrated. The temperature is just making you sweat, but you are not moving. You are not doing anything to cause this sweat. So you are not burning calories, and therefore people like saunas, but if you are trying to do this, you know, to lose weight, probably this is not a good idea or a good choice. Go to diabetes.org. The diabetes.org, then you will see a tab for professionals, and find the CHW tab, and then you are going to do this, and the only thing that you have to do is to register, and you have access to 3 or 4 self-paced training modules. All right, these are our contact information in case you would like to talk to us. My email address, Fides and Chantel's. Anything that you need from us, remember that you are going to receive a link for the resources, the recording for this session, and the slide deck. And again, if you have any questions or you need anything else from us, just make sure that you contact us. It's been a great pleasure to have hosted this activity, and thank you, Fide, and thank you, Chantel, as well. And to all of you who participated, we would like to thank you, and we hope that this was something helpful for all of you. Thank you, and have a great afternoon.
Thank you.
Thank you.
Thank you.